I'll get her some more for the more shadow boxes that she wants to do. So can you give those to Kelly for me?
Yeah.
It's empty, Jansen's. Don't get too excited.
Well, I may sell these.
Apparently they decided to do some more shadow boxes. So
Okay, great.
anyway,
Thank you.
and you can tell her that we did send one to, well, we actually sent about 3 of them down there and told him if he wanted to give the governor one, that's fine. If he was still speaking to her, if he wasn't speaking to her, then you could tell her what to do with it. Mayor, how are you?
I am well, thank you. How are you?
How's the city of Decatur? Not well. How's the city of Decatur?
The city of Decatur's fine, other than they're sick. We're sick.
I'm telling you, everywhere, everywhere.
right.
I mean, everywhere.
We're piecing it together.
Congratulations on your award.
Oh, thank you.
That was very, very nice.
Thank
And I
you.
know it had to be a tremendous honor.
It was a
anyone.
shock.
Well, why were
But
you
yes.
shocked? I knew it ahead of time. Hey, did Dr. Harris get to come up?
Yes.
Did he? I knew he wanted to. I
Yes,
knew
he
that.
did.
Okay.
He's speaking at Rotary in February.
Well, he hadn't told me. I need to know what day that is so I can act like I'm working. Which is not a real
I'm
problem.
not gonna tell you.
It's not a real problem right now, I'll be honest with
So
you.
I've continued my.
So he's gonna come up, dear Lord, I don't know how he has time
I
to
understand,
read.
I understand.
So you think it'll redo over?
My close
So we have a
contact,
backup recorded? Okay.
protocol
Yeah.
continues to reset.
I thought I just created a new
basis.
event, but, you know.
Oh, absolutely, and I'm just gonna tell you, that 6 foot,
And it
15
doesn't
minutes,
matter.
that's out the door. That is gone by the wayside,
So
so.
getting it with the new,
I mean, basically, this is so contagious, you don't know, you could.
hey, good morning, and thank you for joining us today. We had hoped that when we paused our press conferences last time, that we might be suspending them indefinitely. Unfortunately, cases have significantly increased in our area over the past 3 weeks, and our dedicated healthcare professionals thought it would be good to come back and start doing our press conferences again. So they're here to talk with us today about the latest news and how to keep your families safe. So with us, we have Decatur Morgan Hospital Chief Nursing Officer Anita Walden back with us today. Anita, it's good to have you here. And then, of course, we have from the Alabama Department of Public Health, the Administrator for the Northern District, Judy Smith. Judy, thank you for joining us today. Good to have you. So just a quick update. As of today, we have right at 28,850 total cases in Morgan County, as reported by the Alabama Department of Public Health. The moving 7-day percentage positive rate is 48.7%. And in the last 7 days, approximately 2,024 positive cases have been reported in Morgan County. So that's approximately 52,121 residents have completed their 2-dose vaccination series. So we're encouraged and thankful for those who have done that. There's still opportunities for those that are willing to go and receive their vaccination, or for those who have been vaccinated to get your booster. So, I was just talking before we came on air that I'm masked right now, I'm distanced, but I'm in, I guess, what's called the close contact protocol. So that is, I've been vaccinated and received the booster, but with that, I've been in close contact with someone who tested positive. And the thing about that there's nothing funny about it, but the thing that I kind of snickered at is that I continue to have to reset that date. So it's a 10-day from the time that you've been in close contact with someone who tested positive that you mask. And it's so I had been in close contact with someone last Thursday. Well, someone that I was in close contact with tested positive yesterday, and so that 10-day period now has been extended to post yesterday. So yeah, I'm sure that I'll get another opportunity. But anyway, we want to do our best to follow those guidelines and to be sure to help those around us. So with that, Anita, would you give us an update from the hospital, please?
Sure. So as of this morning, we had 68 positive patients in the hospital. Those are spread out from the medical floor to the step-down unit to the ICU. We keep them on those 3 units. Their average age is about 65. We have a few more males than we do females. We have 10 in the ICU, 5 of those are on ventilators. We have many more on BiPAPs. So we're hoping that those don't convert to having to have a ventilator. We keep hearing that Omicron is not that bad. And for the most part, that's true. It doesn't seem to be as bad in most people. But having 68 patients in the hospital, that tells you that for some people it is bad. For some of those people, it's really bad. Those are in the ICU. There are lots and lots of people that have it. Lots and lots of people are sharing it with everybody around them. There's a lot of people that want to be tested to see if they have it, whether their children brought it home to them or they've been around somebody that they were not suspecting had it. We have lots of hospital employees catching it. Lots of our businesses, grocery stores, restaurants, everything that affects all of us, those employees are getting it. Our staffing levels are critical. That is not just in nursing. That is respiratory therapy, lab, imaging, dietary, EVS. It's across the board. We are piecing together, literally, our staff. You may see some of us helping serve with dietary. It's bad. As of yesterday, we had 96 employees quarantined and unable to work. That was down from 106 the day before. We have at least 229, that was yesterday, employees who were self-monitoring for symptoms. That means they're probably working, but they're just making sure that they don't have a temperature or other symptoms. We're testing dozens of patients and staff in the hospital every day. Over the last 7 days, we've tested 1,871. We had a positivity rate of 44.6%. We're testing dozens more, about 120 to 140 a day at our drive-through clinic, and that's across town. That's where you drive through, you never get out of your car. Those drive-through hours are 9 to 2 every day, and beginning next week, we'll be open 9 to 6 every day. And so please, if you're not sick, if you're just exposed and you want to know if you have it or not, please go to the drive-through. Testing at the hospital is limited to patients and employees. If you're sick, please don't hesitate to come to the hospital. When I say if you're sick, that's with more than just your flu symptoms. Chest pain, shortness of breath for sure, stroke symptoms, please don't hesitate. What we have seen since our last spike is a lot of patients waited to come to the hospital, and for some of them it was too late. So we want to encourage people, you know, we are very busy in the ED, but we're not telling really sick people to not come. Our ED is packed. As of today, we're holding 12 patients, and those are all kinds of patients. And all the patients that I just mentioned with shortness of breath and stroke-like symptoms and abdominal pain and accidents, all those things are there. Our visitation is in the red. Now what that means in the red zone is we are allowing one visitor per patient, but we must protect our patients as well as our staff. It's imperative. So we're a stickler for your mask. When you come through the door, you've got to have it on. If you're going to see a COVID patient, PPE is absolutely imperative. That is your protective personal equipment, and that would include maybe a gown, gloves, definitely an N95 mask. So if you are coming to visit a COVID positive patient, please don't enter a room until you've spoken to a nurse. We're in this together. We're doing our very best at the hospital. We're trying to take care of each other as well as our patients. And so please bear with us. We appreciate our community as always, but we are asking, please bear with us. Get your booster. What we've noticed as I was looking at all the COVID patients yesterday, the one thing they all have in common is they're not boosted. So about almost half of them had their vaccinations, but if you're not boosted, then you're very susceptible.
So with that, not boosted, but they were within the time limit to receive a booster?
Almost all.
Almost all, okay. So I went, excellent report, thank you. Anita. And were you through with your report?
Yeah.
Okay, I'm bad to jump in sometimes.
That's okay.
So I was invited to visit a patient at the ICU Sunday, ICU 1, and went in masked and sanitized, all those things, and walked in, and so there's the spouse and a mother, and here I am, and the charge nurse comes in, and she's doing a little work, and she said, boy, you know, there's only supposed to be one per room. And she didn't waste any time. I asked if I could pray with the family and leave, and I did. So anyway, we certainly understand that.
We do make some exceptions, especially end-of-life patients. And sometimes there's just special circumstances where we may allow more than one to come. But we've still, you know, there's the emotional needs of the patient. And if we can do anything safely, we will do that. So
I respected what she said.
We appreciate that.
Had you been the charge nurse,
there's no telling what would have happened. Well, I'm going to build on what Anita has said, and first of all, I want to say that the comments that she has made are pervasive in almost every healthcare arena we have right now. People are literally overwhelmed. Our businesses, as you said, have a lot of people out. The city of Decatur, I think, has a lot of people out. Those folks who are there to protect us and to see about our other needs have a lot of folks out. You know, if I could use the one French word that I know, déjà vu, you know, when I was young, I never did like the glass houses that were at the fair, because you went in there and you had to feel until you found the door to get out, and then you were just in another room and you had to feel until you, and I think that's how most of us feel right now. You know, this is a Ferris wheel that has gotten hung, the motor's gotten hung, and we just keep going on. We will, as of March, be fully 2 years into this in Alabama. We will have had our first case as well as our first death. And we're still dealing with what we should have been able to resolve. And I will say on behalf of the hospital and the health department, our goal is for you to be healthy. Our goal is for you to stay well. You know, our goal is for us to be able to do what it takes for you to move on and have a reasonable life. I will tell you that this month, we have gone into a new year, 2022, and as of this year, we in Alabama have passed the 1 million mark in terms of total cases of COVID. We have also passed the mark of 16,734 deaths. I also want to remark to you that 274 of those have occurred in the first 18 days, 19 days I guess now, of this month. We are halfway through the first month of this year and we have already had almost 300 deaths. To add to this, which is somewhat different than what we have had before, is the pediatric impact of where we are right now. And I will tell you that as of yesterday, there were 93 children across the state with confirmed COVID. There were an additional 27 that were suspected, for a total of 121 children across the state. Now this is something we didn't talk a lot about before. It was all us old folks that folks were worried about, but now we're talking about our children. 12 of those children are in the ICU and 4 of those children are vented. Listen, we don't want, I think I can speak on behalf of the hospital and myself, we don't want anybody else to have to go to the hospital. We don't want anybody else to be sick. We don't want to have to send one of your children to Children's Hospital or to any kind of a children's unit in order for that child to be taken care of. So we are, this is truly tough times. I don't know how many of you saw on the news this morning, but I am going to just show this. I don't know whether it can be seen or not, where a mother had actually said, "I wouldn't wish this on my worst enemy," and this was her child, her 1-year-old child, and she said, "We wondered what it was going to all be about," and it ended up being about wires, tubes, and a lot of questions. And so that's what we're dealing with right now. It's not an attempt to have a scare factor. It's an attempt to keep folks well. I will also agree with what Anita has said, that testing is overwhelming us. It's literally overwhelming us. And you heard the numbers from the hospital. The health department has those same kind of numbers in every health department we have. As a matter of fact, this morning before I came, one of the things we were struggling with was the possibility, because we have so much staff also down, that combining health departments in order to be able to test. For example, would we do this one in Limestone County where, Monday, Wednesday, and Friday you could go to Morgan, and Tuesday and Thursday you could go to Limestone, simply so that we could consolidate our staff. We have not done that yet, but that certainly is a possibility if things stay like they are. I mean, right now we are offering testing and vaccination 5 days a week, but that's kind of where we are. Folks, we had a new terrible teenager to come to town. His name was Omicron. And please don't name your children Omicron if you had any babies. But he is a rebellious, out of control teenager. And if you've ever had one, if you've ever dealt with one, you know what it's like. They disrupt the family, they disrupt the school, they disrupt everywhere they go. And quite honestly, this virus doesn't care. It really does not care. One of the things that we have learned early on is that it is not as affected by the 2 doses of vaccine. Therefore, the booster has been recommended. And as Anita has already said, and my numbers, she has the direct numbers from the hospital. I get what is reported to the state. But according to the state numbers that were reported yesterday from Decatur Morgan Hospital, 76% of the patients that were there were unvaccinated. Only 2 of them had been boosted. So the others were in various stages of getting either incomplete vaccinations, but they certainly had not gotten their boosters. We do know, or it's clearly evident, that those people who are boosted tend to have a much milder infection. Now, I will say this, and it is true, this teenager, Omicron, just doesn't care, and he is still going to affect you even if you are vaccinated. The thing about it is if you are fully vaccinated, which means 2 doses and the booster, if you're eligible for the booster, you are much less likely to end up in the hospital. You're much more likely to have a very, very mild case. Now, on top of that, I do need to tell you, we're out of rapid tests. Now, we're expecting to have some more. How are you all, Anita? Are you still you don't have rapid tests? And you know, everybody wants to know right now what their test results are. Listen, if you're sick, stay home. You know, having the test that says you have COVID really changes nothing unless you need medical care, you need to go to the hospital, or to be fair to you, if you need it for your business, your employer requires it, and we're doing everything we can to try to work that out. But right now, the labs are so overwhelmed themselves that the turnaround is anywhere from 3 to 4 days to get the results. Well, if we're telling you to go home under the new CDC guidelines for 5 days, by the time you get the report, by the time we can tell you whether you're positive or negative, your isolation quarantine is either up or it's almost up. If you're sick, go home, stay home, hydrate, do what you need to do. And one other thing that I want to, oh, by the way, I do want to mention, you can now get your home kits. The home kits are now available. And I actually brought the websites, and I will leave them here with the mayor and folks, but these are the websites that you can go to get your test kits, your home. Every household is going to be allowed 4 kits. And I will be honest with you, a couple of us did it yesterday just to make sure it worked. We actually did the U.S. Postal Service one at the top, and I actually within 15 minutes got a confirmation back that my little test results would be on their way. Now, just for the record, I don't want them, and so when they come, they'll be for sale or giveaway, depending on.
I did the same thing.
Well, we tried, but you can get your kits. You know, once again, however, you know, I question. You know, yes, you know that you have COVID once you have the test. But at that point, what are you going to do? And I do want to talk about that just a little bit. You know, there are the monoclonal therapies. So often earlier, what we did is we just waited. We didn't want to get vaccinated, so we waited. We got sick. We ran to the hospital, or we ran to an infusion center, and we got the monoclonal antibodies. One of the things that has happened with this rebellious teenager that has come to town is they're not really amenable to most of the monoclonal antibodies. They so badly that at one point the federal government actually stopped sending them entirely because we were treating people with something that really wasn't effective against the Omicron virus. So, but one of them actually is, and they have restarted those. However, they're in extremely limited supplies. As a matter of fact, we were talking to one of our major hospitals in the north yesterday, and they told us that last week they got 20 doses. Well, when you're having 12 and 13,000 people a day in Alabama who are positive, there is no way, even in the north, or with what the mayor has already told you, there is no way you can match 5 or 10 doses of a monoclonal antibody to thousands of people that are having COVID. So, you know, if you're sitting there relying on that, it's going to be tough. The antivirals are going to be exactly the same way, and it may have been upped a little bit this past week, but I do know that they were going to the Walmarts across Alabama. Initially, they only went to 37 Walmarts. Now I think every county that has a Walmart, and I guess that's every county, is getting some, but they were getting 20 doses of antivirals. So to try to, number one, get an antiviral, and most of them are out within 30 minutes of the time they receive the antivirals. So folks, we can't depend on somebody else to take care of us. We've got to work on taking care of ourselves. And I will repeat something I said a long time ago. It's a heck of a lot easier to stay out of trouble than it is to get out of it once you get in it. And that's what we really want you to do, is we want you to get out of trouble, stay out of trouble. I do want to tell you that, you know, there's been a lot to do about the mask and what you should do about the mask. Now, I'm going to show you, these are both N95 masks. The hospital tends to wear those in more of the high-risk situations. I personally don't like them because they have to go over your head and they mess up your hair. Not a good problem, is it? But at the same time, they're hard to get. They're a little harder to wear. But both of these are examples of N95 masks. Then I have on a KN95. Now you can get those and you can order them. It's your selection. Then, in addition to that, you can use basic surgical type masks such as this one, double mask, and wear whatever your decorative mask, the one that coordinates with your clothes, on top of it. But having said all that, let me say, the problem with masks is you gotta wear them. You've got to wear them, and you've got to wear them correctly. You've got to wear them full time. The mayor had talked earlier about 2 or 3 places that he went, and you may wear them at work, you may wear them when you're in the hospital situation, but then you turn around when you get home and you take them off. Your child's come home from school, your small child has come home from daycare, you stopped by the grocery store and you didn't have your mask on. The bottom line to it is, if it's not worn correctly and all the time, it's not going to work, because this rebellious teenager has brothers and sisters everywhere. And I'll also go back to a different thing that I use, the cockleburs. They're just like little cockleburs. They are everywhere. And if you walk through somewhere, they're going to get on you. And when you get home, then you're going to think, well, geez, I've got a little bit of a cold. Well, geez, your little bit of a cold it very probably could be COVID. So, but once again, if you're not really sick, stay home, stay away from other people, take care of your family. And when I go back and I talk about the children, when I was giving you the numbers about the children, who's responsible for taking care of our children? We, the adults, the decision makers, the people in our community, we're the people that take care of these children. We're the ones that make those decisions. So if I take my mask off and I'm exposed to somebody and I go home and I've got a child at home, that child goes to school, guys, we've got to get these kids back in school. We've got to keep these kids in school. These are the people that are going to take care of us and deal with these kind of situations when we get old. One of y'all will be taking care of the mayor when he gets in the home. But at any rate, if you have questions about the quarantine isolation thing, we'll do everything we can to take care of you. The one thing I will say to you is that the vaccines are still the predominant answer. Now, I know a lot of people have made up their minds about how they feel about it, but I go back to the evidence is there. Anita has told you, I have told you, I can give you that data across the state. 75 to 80% of people who are in the hospital are totally unvaccinated. Another 10 to 15% are incompletely vaccinated. So the thing that we do know is, and does it work for everybody? No, it doesn't. We have immune suppressed people that have had a very difficult time building antibodies, even with extra doses of vaccine. But we, once again, are the people, those of us that can get vaccinated, we are the people that are responsible for making sure that we don't expose other people. And I brought these, the vaccines can be so confusing. Anybody 5 to 11 years of age can get Pfizer vaccine. And to my knowledge, you all give it, don't you, Anita?
Yes.
The health department gives it, a lot of the pharmacies give it. Some people do children, some people do not. Anybody 12 to 11 can also get Pfizer vaccine, but the hospital gives it, the health department does not, because we only have the pediatric Pfizer. We're only keeping the pediatric Pfizer because of the ultra cold storage thing. We can only keep a small amount at a time, and since we have historically been the vaccinators of young children, we have tried to take that burden, because so many people do not want to take care of are not comfortable with giving immunizations to young children. And then those that are 18 and older can pretty much get vaccine wherever they want to. You still have J&J, you still have, although we'd love for you to take Moderna or Pfizer vaccine, and the hospital has both. The health department continues to do Moderna for adults. So, Anita also said something that I'm going to disagree with. She says we're all in this together. I think we're all suffering together. But I will tell you that even in a football team, when you've got a Heisman Trophy winner, if everybody doesn't hold up their end of the team, that team's not going to win. That team's not going to do great. So, Yeah, the consequences, we're all in it together, but we need to all be in it together on the preventive end of it. And I didn't mean that derogatorily, Anita,
I
just
didn't take
whatever.
it that
So
way.
now I do want to end on a little positive note and say that there is some evidence in other countries as well as in states across the nation that there may at some point within the next 2 to 4 weeks be a peak. I will be up front with you, we're all praying for that. I mean, we truly are praying for that because I don't know how long we can keep going at the pace that we are going. So hopefully we will reach the peak. We've been there before. We don't want to get the Ferris wheel continually hung up. We want to go on our own. I'm going to close by asking 2 things. First of all, please be kind to your healthcare providers and to your other people, other folks that are working in the city of Decatur, the people that are taking care of you. I cannot tell you how many times every day I have people call and complain because they couldn't get in, nobody was answering the phone, and I will say to you up front, when half of your staff is gone, when a third of your staff is gone, and you're still there doing everything you can, thank them for being there. I will also share with you yesterday when one of our nurses could not come and we were trying to do a 2-man team to do our testing and one of them couldn't come. The other nurse has been there for less than 3 months and she almost quit. She said, listen, people are being so ugly to me. They're impatient, they're mad because I can't get to them, they're mad because whatever. Guys, as Anita said, we really are doing the best we can. We really and truly are. And when you're down, if you want to come and answer the phone for us, we'll probably let you do that and let the people fuss at you. But think about what's going on and realize that those people who are sticking with it and staying with it, they literally are doing the best they can. And instead of fussing at them, even if they do seem tired, and let me also add something that Anita said. There are some hospitals across the north and in Alabama that are actually paying folks overtime, major overtime, because we are so short-staffed to take care of a patient. Now let me say to you, do you want an exhausted, tired nurse being the nurse that has to take care of you in ICU? But she's giving her all, and she's doing all she can, or the other not just the nurses, but the other healthcare workers. So hopefully we're at a peak. I ask you to please be kind to people. And one additional diversion, the blood banks are struggling and having a terrible time. Please, if you're not sick and you're in a situation where you can give blood and you have somewhere to go, whether it's whichever blood facility you choose to use, we beg you to think about giving blood. The shortages are as short as they have been in a long time. And somebody in that hospital, in addition to needing that nurse and needing that custodian and needing that doctor, may also need that blood. So thank you, and thank you, Mayor. I apologize, too much to say.
No, ma'am, don't apologize for a thing. Are you, and I don't mean to put you on the spot here, are you in a position to talk about the different protocols? So I mentioned that I'm in a close contact protocol right now, because I've been vaccinated. Can you speak to that?
Absolutely. As a matter of fact, we even have some handouts, and I'm going to leave them with Anita in case she wants to order some from the state, that tells you what to do if you're positive. Now, when you come to get tested, we know that your test is positive at that time, we're going to go ahead and mark something to tell you that you're positive and this is what you need to do. But the bigger issue that we get into, quite honestly, are the people that have been exposed to somebody. And I will tell you up front, if you have been exposed to somebody, you know that you have, and you have completed your vaccine, including your booster, or it's not time for your booster, then you are allowed to wear a fully closed mask, just like we talked about, for 10 full days. That's general population rules, okay? However, if you are not fully vaccinated, you have not had your booster, you have not had your vaccine, you are supposed to go home and isolate, quarantine for at least 5 days. But now, let me give you the caveat to that. First of all, those 5 days don't start until the last day you have exposure. So, for example, if your child is sent home from school because he is a positive COVID, Then his day started the day he was tested, and it's really the 6th day because you start today and tomorrow's day 1 and then day 2, day 3. So it's really on the 6th day is he has moved forward 5 days from the test day. Your isolation quarantine does not start until your last contact with that child. And if you're a mama at home taking care of that child, then it does not start, your day 0 does not start until then. So, actually, I had a call from one of my environmentalists, and by the way, to tell y'all how dire things are, on the way up here today, I had called one of my environmentalists and told him to go answer the phone and take calls and register patients for the COVID clinic. That's what we're dealing with. But he was telling me that one of the other environmentalists, one of his children has tested positive, and that was 3 days ago. The other child is now being tested, and they expect it to be positive. So once again, he had 3 days on that first child. He'll start over on day 5 for 5 days with this child, really pushing to day 6. And then his 5 days won't start until after that because he's not fully vaccinated. He did not get his booster. Now, think about that in terms of being off from work. And listen, I don't care how mild this is. Sick is sick. We don't like being sick. I don't care. I pray that everybody who has it has a very mild thing, just a little cold, and will stay at home. Unfortunately, what they do is they hide and go on to work, and then but nobody enjoys having the flu or having flu-like symptoms or having a headache for 5 or 6 days or whatever. Now, some people may enjoy being out of work, but that's probably for the wrong reasons. But listen, I actually have you the new quarantine guidelines, and I was going to leave them here with you and Emmy, and we can get copies for you to give out.
Thank you.
We also have additional handouts that are available, and we will be giving them out, and I can get Anita any that she wants, that says if you're not fully vaccinated, this is what you do. If you are fully vaccinated, this is what you do. But to be honest, if you're fully vaccinated and asymptomatic, fully vaccinated means with the booster or not time for your booster, then you can, and asymptomatic, you can isolate for, you can use a mask, a significant mask consistently and right for 10 full days. And, but if you're not, then you're supposed to go home and isolate for 5 days. Quarantine. I'm switching my words up, but y'all know what I'm saying.
No, you're doing a great job.
Anyway.
And so I think it's, you talked about staffing levels. Everyone's dealing with staffing levels. And it seems that the close contact qualifications, once you hit what you just outlined here, that's what's having the biggest impact on our staffing levels, well, instead of the positives.
Right. That's exactly right. The exposures. That's exactly right. Yeah, you're right.
So with that, we're working and doing our best to make sure that city functions that are essential, that we remain operational, and we will be able to do that. But as it was mentioned, that if you end up calling and you don't get someone in that first attempt, please don't grow frustrated with that. And if we're a little late right now on getting around, not collecting solid waste, your trash and such, we're going to get that. But as far as getting debris, limbs, things of that nature that's on the side of the road, that may be pushed out a week or two longer just because the way that we're having to establish our priorities. So we do ask for your patience with that. And then our communication specialist is probably getting nervous here, not knowing what I'm about to say, but we are doing without some of our Department of Corrections personnel, and so that is having an impact on some of our recycling services, as well as trash collection with Parks and Rec. But we will, once that's reinstated, we'll be able to get caught up. So just bear with us. So more than ever, our cases are rising, and get tested if you aren't feeling well, and take personal responsibility to prevent the spread of COVID. We know that it's impacted us all. It was discussed a while ago. Goodness, we're human. We must admit that fatigue sets in, You know, we really wanted to be on the other side of this. We're tired of it, but we're tough people, and we're going to persevere, and we're going to do it wisely and kindly. Let's remember to check on our neighbors, our elderly residents, and our friends. If you want to get vaccinated, you can visit the health department, the Decatur Morgan Vaccine Clinic, or go to vaccinefinder.org to locate an additional vaccine provider. Before we sign off, any closing comments?
Just let me mention, for vaccinations, most of our pharmacies are also giving vaccines, and it's very quick and easy. So I would encourage people to go to your favorite pharmacy, the one that you patronize, and get your vaccine there.
Very good. Thank you, Anita. Anita, it's good to see you, and we haven't seen you since you received the Cadell Grisham Award. That's a very respected award, and one that you deserve. And we're very proud for you, and it was a special night as you were recognized.
Thank you.
Along with Senator Ward.
Yes.
Yeah.
Thank
Right.
you. Thank you.
All right. And Judy, you'll be on deck for the next one, I bet you.
Nah.
Until next time, be safe. And as Judy mentioned, and I know Anita, she's got the same thought, be kind. Thank you, Decatur.